This video is all about plantar fasciitis, but before we go into that, there's some things that you really must know. It's about terminology, but the sooner we all speak the same language, the better. So let me put my magical clipboard up on the screen, which I'm going to use to draw things and to explain things better. Plantar fasciitis is a condition that is more often than not diagnosed using clinical tests. But these tests can't say for sure if there's an inflammation response going on in the fascia. So the term fasciosis is more correct. However, because everybody uses the term fasciitis, so will we in this video. If we draw a large circle called inferior heel pain, we can then draw little circles inside it with the causes of heel pain. Let's imagine a subcircle which contains all causes of pain in the plantar fascia. We can certainly put fasciitis in this subcircle, but even here, plantar fasciitis has to share its space with two other fascia conditions. Now don't get confused by this. Plantar fasciitis is still more prevalent than the other two conditions in this circle. In fact, it is still the most prevalent cause of inferior heel pain. But nevertheless, you still need to rule the other fascia conditions out. Don't just assume that it's plantar fasciitis. Amongst the causes of inferior heel pain, we have things like soft tissue, bone and nerve condition, and you can pause the video here if you want to take notes for a later search. But let's forget the other conditions and focus on plantar fasciitis because, as I said, this is the most common cause of inferior heel pain. I mean, it's so common that most research studies on plantar fasciitis either start with or have a sentence in the introduction stating just this. Do you want to see? For those who haven't seen my 5-minute anatomy video, link down below. The plantar fascia is simply a thickened fibrous aponeurosis. So an aponeurosis is just a fibrous connective tissue similar to tendons. However, in flat muscles or flat surfaces like the plantar of your foot, tendons are replaced by a wide band with a wide area of attachment. That wide band is an aponeurosis. So if you hear someone talking about the plantar aponeurosis, you already know that it's the plantar fascia they mean. The plantar fascia is divided into 3 bands, the medial, the central and the lateral band. But it's only the central portion that originates from the medial calcaneal tuberosity on the undersurface of the calcaneus or in the inferior heel region. Well, the plantar fascia has physiological functions like protecting the large network of plantar blood vessels and aid in the venous return of the blood to the heart. But the plantar fascia also has a very important biomechanical function. But for that, you're going to have to search my video on the windlass mechanism or the longitudinal arch load sharing system. Sometimes the plantar fascia suffers micro tears, which then triggers an inflammatory reparative response. A normal fascia has a thickness of 3 mm, give or take, but in a fasciitis condition, it can go up to 15 mm. That is 5 times the thickness. An inflammatory response in the plantar fascia is a plantar fasciitis. Good question. Well, it can tear for several reasons which are up on the board right now. But what you need to understand is that not only athletic populations develop this condition. For instance, fat pad atrophy, which is the reduction of thickness of the adipose tissue at the bottom of your heel, increases at the age of 40, which will then expose the fascia to further impact and biomechanical stresses. Diagnosis of the plantar fascia is actually made with a reasonable level of certainty using clinical assessment tests. There are functional outcomes questionnaires for this, but the symptom that most patients will report is a sharp pain localized at the bottom of the heel, which is more painful with the first steps in the morning or after long periods of rest or inactivity. Patients will also report that the pain decreases with the increased level of activity, but that it will get worse towards the end of the day. History taking is very important because usually there has been a change in the volume of the physical activity or simply life changes that require more hours of standing or walking. Adding to the symptoms and patient history, there are physical examinations that can help with the diagnosis. These are up on the board right now. I'm not going to go through them in this video. I'll have a separate video for each one of them, but in the meantime you can pause and look them up online. There are lots of interventions available, and every week someone seems to come up with a new treatment for plantar fasciitis. But what do we really know about these treatments? What do studies tell us? Well, let's start with conservative treatment, which are the non-invasive, non-surgical options. In this basket we can put things like orthosis, heel pads and arch support. We can also put shockwave therapy, oral anti-inflammatory drugs, exercises, deep tissue massage, night spleens and even functional taping. Now, because I don't really like needles, I'm going to put steroid injections in the invasive procedure basket, even though these should really be in the non-invasive treatments. But sticking a needle in your heel seems quite invasive for me. And alongside needles comes surgery in this basket. Now, I have a video on treatment options for plantar fasciitis, which covers all of these up on the board, so make sure you watch it because I go into a lot of detail and I also review a lot of literature on the treatment options for plantar fasciitis. So for example, if you'd like to know things about shockwave therapy for plantar fasciitis, what does it do, how long does the treatment last for, will it cure me, then that video is for you. Let's talk about the biggest mistakes a patient with this condition makes. Number one, thinking that YouTube videos will cure your fasciitis problem. YouTube videos such as this one, and there are a lot of informative videos, will not cure your plantar fasciitis. They might give you motivation for you to persevere, but you have to do the work. They might give you the knowledge and point you in the right direction, but you have to do the work. You have to take responsibility for your body and start fixing these issues yourself. Because let me tell you, no one is as motivated as you are to sort out your injuries. Thinking that this will be a quick fix. You won't. Plantar fasciitis, guys, can be so demoralizing because it takes time to heal. I mean, it just lingers for months. You have to be patient and persevere with the treatment. Be brave and don't run away from pain. Increase your range of motion step by step, little by little, and your pain will decrease. But don't run away from pain. Mistake number 3, thinking that this is a localized issue. It's not. Well, the lesion itself is localized to the plantar aponeurosis or the plantar fascia, if you've been paying attention. But plantar fasciitis is a result of biomechanical inefficiencies somewhere else up in the kinetic chain, or an acute increase of activity volume. So you have to look at your whole kinetic chain from feet to hip to torso. I talk more about this in the video about treatment options, so make sure you check it out. Didn't I say 3 mistakes? Oh well. Mistake number 4. Letting the pain limit you. Don't do that. Own the pain, don't let it limit you. But you know what? You don't have to believe everything that I told you. You can just go and read the references. Okay guys, that's it for this video. I hope you enjoyed it. Don't forget to subscribe to the channel. It's all about science and making knowledge accessible. Ta-ra!